The Haiti Hope and Healing Project is designed to strengthen the Haitian community's ability to support the emotional health of children and adults who are coping with the trauma from the January 12th, 2010 earthquake. The children and families' needs in Haiti are very much the same as those here in Rockville and in the D.C. area. I mean, it's really our common humanity. And we're talking about basic child and family development. So what we heard from the Haitian parents was their concern and hopes for their children to be nurtured, to feel protected, to be safe, to be able to learn, feel pride in their accomplishments, to have friends. And those are the same conversations that we have every day here at the Lourie Center. The Lourie Center was invited to participate in this program due to our longstanding expertise in child and family development, as well as our experience in supporting children and families who've undergone trauma. And lastly, is our ability to work collaboratively and to provide expert training to support vulnerable children's social-emotional health. The key therapeutic approach that we utilized for the training really focused on transforming trauma. Not only for the participants, but then to give them the skills and techniques then to help and work effectively with the children who they be seeing on a daily basis. So to do this, to help in this transforming of trauma, one of the key elements is being able to help people tell their story, whether you're a child and doing it in play, or whether you're an adult and using words. And so the training then designed several different activities for the participants to join in, through drawing, through therapeutic puppet play, and painting. The most poignant moment of the training came on the third day when we asked participants to bring rocks from home. And of course, rocks represented death and loss of life. And we asked them to decorate the rocks and paint them to tell their story. And of course, the idea there is to transform the symbol into to transform the symbol of death and sadness and loss into one of hope and honoring those who had passed. And so one by one, each participant, each teacher and children's minister came up before the whole group and told their story of the rock. The rocks were then assembled in a rock garden, and there were lots of pictures taken and lots of discussion. And the feeling of the room was one of real unity, of a shared experience, of mastering an overwhelming and terrifying experience. Where we see that come to fruition was 3 days later, when we were at a school. There were about 100 children there on a typically very hot day in Haiti, and we were in temporary shelter. And a child, probably at around age 10, approached to the front of the group, and she held a rock. She held a rock. And she addressed her friends and those of us visiting. And she described the red color in her rock design as being that of the blood of those who had died. And the yellow for all those who had come to help. And the green was for the hope that things would be better. So right there, right in that moment, we saw the healing, the overcoming of trauma beginning. When the team visited in May for our first trip, it was really about assessing the needs. And so we talked, and mostly we listened to what children were telling us, what parents, teachers, pastors, and church workers. And we heard, of course, the overwhelming need for housing, for jobs. But mostly what they wanted to tell us about was their emotional needs. What they were noticing in their children and in themselves 5 months later. So in addition to the rebuilding externally that was taking place in Haiti at that time, really a recognition for rebuilding the internal sense of safety, of ability to connect with your child. So this rebuilding internally, that's also a great hope for the future. And part of really what the project was about is really empowering the Haitian community to support their children and their adults, to reestablish that sense of safety and security so that they can be purposeful and rebuild their country and their lives. They're so courageous. You can't help but be awed by their willingness to confront one of the worst catastrophes that we know could happen. In 35 seconds, their entire community, their entire life was destroyed. And yet to face that with optimism and with hope, we found a real eagerness, an eagerness to hear what we had to say in order that they could help not only themselves, but help those around them. On the second trip to Haiti in September 2010, we conducted an 8-day training. And it was divided into two parts. The first part was really working with the adult participants, the teachers and children's ministers. The second part was in the field, coaching and supporting them as they worked with children. During that first phase of training, we really focused on several key content areas. The first was earthquake education. Education is so important to understand, well, what happened in that traumatic episode. And then we talked about children's grief and loss issues, about resiliency, and about really supervision and support. I mean, we know at the Lourie Center that when you're working with children, you really need to give full support to those who are caring for the children, whether you're a parent, whether you're a teacher. And so as part of the training, we provided a lot of attention for the participants so that in supporting them and supporting their processing of the trauma in order to be really effective with the children. The project really was designed to be sure that progress was sustainable and really about building capacity within the Haitian community itself. So that's why the selection of using churches and schools, already existing infrastructures. The Lourie Center's participation in the Haiti Hope and Healing Project really has been a privilege. And it represents for us at the Lourie Center something that we're deeply committed to, which is utilizing the knowledge and experience that we have here in supporting young children and families, especially the most vulnerable ones, and being able to share that with the community throughout the U.S., but also internationally.